Deanna Harris, also known as Dee. This is for my instructor methodology for the fall of 2025. Today I'm going to talk about the KED, which is also known as the Kendrick extrication device. It is used for your patients who are in a sitting position. If they're seated somewhere that have cervical pain, back pain, or things like that. Sometimes, unfortunately, it's not used as much as it could be or should be. Not a lot of people use it. They only use it really when they get checked off in school. But it can be used for patients who are in a motor vehicle accident to extricate them out of the car, or if you have grandma or grandpa who fall in the Bermuda Triangle between the toilet and the tub and they're sitting against the wall. So, this is Zoe. She is going to be my patient, and this is Aiden. He's going to be my partner in this. So, we're going to talk about the KED first. It comes in this nice bag, and it has a head strap that we will discuss. It also has padding in case you need to pad a void. Thank you. Thank you. And this is the actual device that goes behind the patient. And I will show you how we do that and a mnemonic that will help you remember how to apply it. So one of the mnemonics that we use is my baby looks hot. Okay? Well, my baby, let me show you. My baby looks totally hot. So to remember how your straps go, you think of that mnemonic. My baby looks totally hot. So I will show you how it goes. So this would be middle strap. This will be bottom strap. This will be your legs. This will be the top. And then this will be the head. As you know that every time you place somebody and you want to secure them, whether it be a backboard or anything, the head is the last thing that is secured. So we're going to start to show you how to use this. So I will take this from you. So we will say that Miss Zoe here was in a motor vehicle accident. And she is sitting in the driver's seat or passenger seat of the vehicle. So a good way to practice this is when you approach a patient, have them always look straight at you so they don't turn their head. And you will instruct them, ma'am, I'm going to have my partner's going to come in behind you and hold your head in place. Okay? And I will instruct my partner to please hold manual ceasefire as he's holding. If you notice, he does have his hands up higher because I will be placing a C-collar on her. Before I place the C-collar, I would like to make sure that my patient has PMS, which is pulse, motor, and sensation of all of her extremities. So you'll come in and you'll pulse. Can you move your fingers? Can you feel that?
Yes.
Okay. Then you'll go down to the feet and you'll feel pulse. Can you move your feet? Can you feel it?
Yes.
And she can. So I have positive PMS in upper and lower. Now I will grab my C-collar and you will measure your C-collar with your fingers. Most everybody is a no neck. You will find some people who may be irregular, but most everybody is a no neck. And you'll lock it in place. All right. Ma'am, I'm just going to place a C-collar on you, okay?
Okay.
All right. So we'll go around and you'll place the C-collar, okay? And a good thing to do is once you place a C-collar is to ask the patient, again, and check the PMS of every patient. Anytime you immobilize somebody, it's good practice to go ahead and just recheck everything. So I'll go back, PMS, feel, can you feel and move?
Yes.
Awesome. Pulse, can you feel?
Yes.
Can you move?
Yes.
All right. So now we're going to have to put this device, my KED, behind the patient. This goes behind the patient just as this, okay? But she is sitting up against the chair. So what we have to do is I'm going to come in and I'm going to hold her just like this, and my partner, because he is at the head, will count to 3, and we're going to shift her forward at the same time to keep her in line, okay? So on your count of 3, we're going to move her forward just a smidge.
1, 2, 3.
All right. All right, so we're there. Now I can place my KED behind her. You will have to go up under your partner's arms. There we go. There we go. All right, now on the count of 3, we'll go back. Ready?
1, 2, 3.
And back. Now we have this where we can place the KED appropriately. So if you remember your mnemonic, I'm going to go upright just like that. And I'm going to come over here and get prepared here. Up just like that. All right. So my first one is going to be middle. My middle. So you'll take this strap and you will clip it right over in the yellow, because they're color coordinated. So this is yellow. The female portion of it is also yellow. Now this you need to make sure is super secure to your patient, because when you move them, you do not want it to move, because it could cause further damage to the patient if it's not secured properly and you go to move them. Now my B, middle, bottom, my baby. It's going to be tight, ma'am, okay? All right. Now we go to the legs. And unfortunately, sometimes your legs get behind the patient where you have to move it. So it's proper. All right, we're going to have to move you up one more time so I can get my things. Ready?
1, 2, 3.
All right, perfect. Thank you. Hold on. All right. There we go. All right. On your count, sir.
1, 2, 3.
There we go. All right. So we have middle, bottom. The next will be legs. Now this is where you're going to get really up close and personal to your patients. And just like when I teach anybody how to do this with males, you have to be super careful. So you will go up under the leg. Okay? And it will go right in the groin. And you will come back around, and there's also a strap for your legs. All right, we have the first leg. Now you come back and do your second leg. Same exact way as you did the one side. Okay, we're going to go underneath. Back here. And strap. And secure. All right, so if you look at the mnemonic behind Mr. Aiden, we have middle, bottom, legs. Now we go to top, which is this one. All right. One more just across your chest, and I know it's tight, but there is a reason for that. All right. Okay. Now we have top. Next, we're going to do head. This is where you may need to keep holding C-spine, please. Thank you. All right. So every device comes with a strap. Okay? You will take this and place it just across the head. Okay? And you may need, keep holding that just for a second. You may need to fill the void back behind the head And this is what this is for. You can slide it in, fold it in half, whatever you may need. Hers does not need to go. So you can let go of C-spine. She's fully immobilized. After you fully immobilize them with the KED, you're going to go back and you're going to check PMS again. Ma'am, I'm going to check it again, okay? Pulse. Can you move your fingers? Can you feel?
Yes.
All right. Pulse. Can you move your feet? Can you feel?
Yes.
All right. Now we have got to the portion where we're able to move the patient. So me and my partner are going to grab our stretcher and our backboard. And we'll go right beside, it's hard to show you because I don't have a car, but we'll go right beside the patient. I'm going to count it. Your count?
1, 2, 3.
All right, right here. So now, after you have a patient placed on the KED, you will utilize a backboard to transport the patient to the hospital. That's my headlocks. All right. On a KED, there are 2 handles on the back of the patient. Right here and right there. And you will grab under the legs. So what me and my partner are going to do, or we're going to do it as you actually move a patient. So we're going to kind of spin our stretcher a little bit. And we're going to place this, I'm going to lock it underneath her body. Okay? You got that side? Okay. And we're going to go right underneath. All right. We can go down. I'm going to go down the structure just a little bit more. Ready?
Ready.
1, 2, 3. All right. All right. So, with this, we're going to place the patient on the backboard and we're going to slide her out. Ready? Let's go for up over the chair or something.
Okay. 1, 2, 3.
All right, she's there. And you can grab both straps on the back and I have her legs.
Okay.
Ready?
1, 2, 3.
And she can move that. And something, go ahead and hold C-spine. Sometimes the Velcro will come undone. So we need to make sure that it stays proper. As soon as you see that it possibly has come undone, I'm going to move her a little bit over here. Yep. And then I'll re-secure this. Thank you, sir.
Mm-hmm.
All right. Now she's secured again. So after we're on here, you can loosen the leg straps a little bit so that the patient is more comfortable. And then we're going to continue to secure her to the backboard. So on a backboard, you do chest, legs, and then just like everything else is the head. Now this patient is ready to be transported to the hospital safely. If you have any questions, feel free to let me know. This is the KED. Bye.